Welcome, everyone. I'm Sue Keisler, Executive Director of xMinds, the organization hosting tonight's presentation. For those of you who aren't familiar with xMinds, we are a parent-led nonprofit dedicated to improving education for autistic students here in Montgomery County, Maryland. I'm very happy to introduce tonight's speaker, licensed psychologist, Dr. Rebecca Resnick. Dr. Resnick specializes in pediatric neuropsychological assessments and is the founder of the group practice Rebecca Resnick and Associates, LLC. In addition to being at the top of her field as a psychologist, Dr. Resnick brings to us her background and training as a special education teacher, which makes her especially insightful about tonight's topic, the role of assessments in special education. I want to mention that tonight's presentation is the second in our new series that we're calling Special Education Basics. It's our effort to meet the needs of parents who could benefit from foundational information about navigating special education in Montgomery County. Tackling one topic at a time, it's our hope that this series will help parents to advocate effectively at school so they can be sure their child's needs are being met. This series will be continuing with monthly presentations throughout the school year, always on the first Tuesday of each month. So before we get started with the presentation, I want to quickly mention 3 housekeeping items. First, simultaneous interpretation in Spanish is available. And if you want to listen in Spanish, please select the interpretation button on the Zoom menu. Also, this is being recorded in both English and Spanish. Second, audience members, please keep your microphones muted. This is not a webinar, it's a meeting. And so that means that you have the ability to unmute. Please be careful not to do that accidentally. And third, Dr. Resnick will take your questions once she finishes her presentation around 8 o'clock. And at that time, we will call on people to ask their questions out loud. If you're more comfortable putting your questions in the chat, that is fine too. You can submit your questions in the chat at any time, and Dr. Resnick will answer those questions during the Q&A portion. I also want to mention that helping with the presentation night, we have Annie Pruitt and Nora Dudwick monitoring the chat. Melanie Carlos will be moderating the Q&A, and Carolina Harp will be translating any Spanish questions that parents write into the chat. So this is very much a team effort. Dr. Resnick, thanks again for being here. I'll turn it over to you now.
Okay, my pleasure. Thank you so much for having me. I'm really excited to be part of the xMinds series, and especially this one in particular. As Sue mentioned, I've been a special education teacher and so have been on the receiving end of a lot of really bad psychological testing reports. And so I feel like anything I can do to help parents learn how to shop for what they need is important. Okay, so here's the part where I try to share my screen. And here we go. There we go. Okay. Sue, I can't see any faces. Is everything okay with this now?
Yes, we can see your screen.
Okay, excellent. So as I'm talking, for those of you who don't like looking at faces or are uncomfortable looking at faces, you can always hide my face as I'm speaking. There's nothing to see here. For people who prefer not to look at faces, I am basically a brown-haired, middle-aged mom with glasses, kind of nerdy looking, and my pronouns are she, her. For the people who do like looking at faces, if you put the face panels in the lower right-hand corner of your screen, I leave that area of my slides blank so that you can put the face panel down in the lower right-hand corner and not have any problem reading the slides. Also, to let you know, I've given Sue a PDF version of these slides. If you'd like that, it has my full permission to send it out to anyone who would like to have it and or post it, because I know this is so much information for us to get through. Okay, so the first thing I want to say is that I'm such a believer in the power of testing and assessment. But of course, with great power comes great responsibility. We know, those of you who are Spider-Man fans, great power comes great responsibility. Anytime you can do something really important for someone, the chance is also there that you could do it really badly and hurt that person. So testing can be transformative. It can be incredibly validating, affirming, life-changing, and many, many wonderful things. But part of the reason I'm here is because we all know that a lot of times it is not those things. It's not a healing experience. People don't walk away feeling particularly understood or like they had a good experience. And I found this picture online from differentbydesignslearning.com, and this one really spoke to me. I think a lot of us have had bad assessment experiences and gone outside and cried in the parking lot. Hopefully tonight I can give you some information that will help you be a better consumer and a better advocate so that this will not be something that happens to you anymore. So I've organized this talk around questions. And usually we think of our who, what, where, when, and why questions, but we're going to go in a little bit of a different order. So first, we're going to talk about why. Why would you do psych testing? Why would you do assessment? It can be expensive, time-consuming, nerve-wracking, stressful for kids. Why would we do that? The next question, of course, is who should be doing the testing? And I'll talk about the different professionals in your neighborhood who can help you get better understanding of your child. By the way, I'm going to be saying child a lot. I realize there may be some adults here as well who are thinking about testing. So please understand, I'm going to try to say child, adult, yourself as much as I can remember to. And where? There's a lot of different places where you could get testing done. It's important to think about where that might be. The when should you get testing and how often? When do you actually need it? And then, of course, there's the what and the how. And this is where I get more into the specifics about what psych testing is and how we can modify it so that neurodiverse people, autistic people, people with disabilities and differences can still show everything that they're capable of doing. So if you're a Calvin and Hobbes fan like I am, my personal favorite Calvin and Hobbes panels are when he makes wonderfully twisted snowman sculptures. So here we have Calvin, very creative, really busy guy making this very elaborate snowman sculpture. And of course, it turns into a snowman who has been hit by a car and is now decapitated. Father looks at mother and says, I think we'd better get that kid to a psychologist. So typically the psych testing journey starts with somebody saying, hey, I'm wondering about something, or this kid seems stressed, or maybe this child or person isn't getting everything they need, not getting their support needs met. So typically it starts with either a parent, guardian, or a person themselves kind of wondering, is there something else I need to know that would be useful to me? And that's the whole point. Why do we do assessment? Here's why, because we need more information to understand a person. It's not about getting scores. It's really about understanding somebody, what makes them tick, who they are, what are their support needs, what are their hopes, dreams, wishes, preferences, all of these things together. This is what psych testing at its best is all about. So we have explicit reasons why you might decide to do some psych testing. And one, of course, is you want to identify people's support needs. What do they need to get rid of barriers, obstacles, stressors, so that they can reach their full potential and have an enjoyable life that doesn't feel stressing and put them at risk of burnout? If you are talking about special education, testing is often about determining eligibility, and eligibility refers to when you then have the right to have an individualized education program or a 504 plan, maybe a change of placement, maybe some special services like speech language, OT. So that eligibility doesn't happen unless there's been some form of assessment, and you have a right to be assessed. That is written into the IDEA special education law. The other reason we might do this is sometimes we want to establish what's called a baseline. And this is what's happening frequently when you have little kids coming in. Now, with little kids, we're getting an assessment that is kind of like taking a Polaroid picture. For those of you who are old enough like me to remember Polaroids, we're getting kind of a snapshot of where a child is in a particular moment in time in their development. And when we want to know, are our interventions actually working, we can't really tell unless we have some data to compare it to. And so sometimes that baseline data is what gives us that foundation to know if we're on the right track or not. Of course, big piece of psych testing is we want to identify people's strengths and weaknesses. Psych testing that only focuses on what's wrong or, is over pathologizing, that's not very useful. It's certainly not helpful, and it can feel really wounding and discouraging. So you want it to be balanced. You want it to be a really honest assessment, but of course, help you understand what are those strengths that you can build on. And of course, when we do psychological testing in the clinical world, what we're really looking for is a diagnosis appropriate? And we'll talk a little bit more about what a diagnosis actually is. Another big reason of why is so that whomever is being tested can access their civil rights. I really love this cartoon. There's lots of versions of it out there. This one I found on howardblast.com, and it's comparing the idea that equality means the same for everyone. Well, justice, equity, equality, diversity, it doesn't just mean everybody gets the same. It means that people get whatever it is they particularly need to remove obstacles and barriers so that they can fully enjoy the game of life, or looks like soccer in this picture. People often throw around the term diagnosis, code, and label interchangeably, and I notice parents are often confused by these. So let's start with diagnosis, and you can see my goofy boys in the picture over there. I put this one up because there's such a contrast between the two of them at this age. One was quiet and the other was obviously not. I think you can figure out which is which. So let's start with a diagnosis. A diagnosis is a clinical term. Diagnoses are only made by clinicians, sometimes educational specialists or people who have particular expertise. But a diagnosis is really a healthcare term. It's a medical term, and it is made by a professional to communicate with other professionals. Here's what this person needs. Here are the obstacles, the concerns. And the important thing about a diagnosis is that we don't make a diagnosis unless there's two things. One is functional impairment. That means that the person's not able to do all of the things they need to or want to be able to do. And the other is distress. So if there's something about a person's differences that is causing subjective distress and functional impairment, then it crosses over from, hey, this is a person with some differences, into this is now a diagnosis. And when it's a diagnosis, that means it's a specific pattern of strengths and weaknesses that should lead to some kind of intervention or treatment. A code is what you get when you're sitting around the table with the multidisciplinary team at your child's school. Codes are what they put on the IEP. Codes are eligibility determinations, and there's a specific set of them. They do not change. They are put into the IDEA law, so everybody picks from things like autism, specific learning disabilities, otherwise health impaired, visually impaired, emotionally disabled. They're all just in a menu. And the interesting thing about when you're sitting around the table with a multidisciplinary team is that most of the people around the table really aren't diagnosers. They don't have that kind of training and assessment. And yet somehow the code is supposed to be kind of a hodgepodge collective process where everyone around the table comes to an agreement about what code the child should have. Codes are not supposed to determine placement or specific interventions according to the law, but I think most of us recognize that a lot of time they really do. Codes are imperfect, but useful. The other one I want to bring to your attention is labels. And I've heard a million times from families that really serious concern that they don't want their kid labeled. And the reason they don't is because most labels are pejorative. Labels are not kind. They're things like lazy. They're things like oppositional. They're things like problem child, space cadet, spoiled. They're not terms you really want attached to your child. Labels are descriptions that people make out of ignorance. They make them when they're trying to figure out what's going on with a child. And the real problem with labels is, first of all, they're not made by any kind of actual data. You don't know what's going on inside that child's head or the why behind the particular behaviors they're showing you, but they're also they really lock kids into boxes. And when there's a label attached to a kid, people stop thinking almost immediately. As soon as your kid becomes the bad kid, the troublemaker, the lazy kid, the space cadet, whatever pejorative labels people put on your child, the instant a label is attached, people stop thinking. This is in contrast to a diagnosis, which is supposed to, as I mentioned, lead us to start thinking about interventions and treatments that have a good evidence base and might actually help.
Dr. Resnick,
Yes.
we just have a question in the chat asking about codes, and she wants to know, are we talking about DSM/ICD codes?
Oh, okay. That's a great question. So yes, unfortunately, our language isn't very precise here. DSM and ICD codes are, these are medical. You submit them to your insurance company. There is a very specific set of research around these codes. They're psychiatric, psychological codes. And that's different from eligibility codes. Eligibility codes are all about special education and nowhere else. So when your child is identified as a child who is eligible for some kind of special education, they don't have access to special education unless they're given a code. And that code is a service delivery code. It is right on the IEP, and it will say something like this, basically this child has a specific learning disability, speech language delay, deaf and hard of hearing, visually impaired, emotionally disabled. It's one of those codes. So yes, it's a very different thing from the diagnostic codes that we use, our nosology that we use to make the differential diagnosis between, say, is this ADHD or anxiety? So hopefully that helps. Thank you for flagging that one. It hadn't occurred to me as I was talking.
Thank you.
So now we're moving from the why to our next big question, which is who. And who does psychological testing? I'm going to generalize to some extent here, and this is going to be kind of Maryland, DC, and Northern Virginia and Virginia specific. So there's neuropsychologists, and the neuropsychologist does psychological testing. A neuropsychologist will have a bachelor's, a master's, and a doctoral degree, a professional license. They are licensed psychologists, and they'll have 2 years of postdoctoral training in neuropsychological assessment. So this is a long time to be in school. Neuropsychologists can diagnose DSM and ICD disorders. Then you have your licensed psychologist, and that's a person with usually bachelor's, master's, and doctoral degree. They have a professional license as a licensed psychologist. That's their official title. If you're ever wondering if someone actually is licensed, you should be able to see that in every signature or every statement they make about themselves. It's their ethical duty to say, I am licensed, here's my license number, so that you can immediately check up and make sure that they're a person who doesn't have any complaints against them. I can't overstress how important it is to work with people who are either licensed or professionally certified. So you have your psychologist, and some psychologists do postdoctoral training, some don't. And psychologists also can diagnose DSM and ICD disorders. A school psychologist is someone who will have a bachelor's degree, a master's degree, and sometimes a doctoral degree on top of that. There are even school neuropsychologists who have postdoctoral neuropsychological training that really is focused on how medical and psychiatric disorders impact learning and education, which is so cool. So they have a certificate in general. They may be licensed psychologists on top of that. And the funny thing about the poor school psychologists is that for some reason, they're not allowed to practice outside of an educational setting. I don't personally agree with that, but that's the way it is. So if you're getting your child tested through a school, you may have a school psychologist. The great thing about a school psychologist is that unlike clinical psychologists, they spend a lot of time learning about specific interventions and special education. The problem with a lot of neuropsychologists and clinical psychologists is that they are great at testing, but not so good at telling you, okay, this reading program, this type of classroom, this placement, this type of behavioral intervention. Your school psychologists are really the wealth of information about, okay, we have this problem. What do we do about it in the school setting? Who else? We have related service providers who can test specific areas of need. And these are your speech language pathologists, OTs, PTs, audiologists, and special educators. Now, these people may have master's degrees or doctoral degrees. I've seen plenty of people with both. So typically you only need a master's degree to achieve like becoming a licensed speech pathologist, a licensed OT, a licensed PT. But there are plenty of folks out there who are like doctors of audiology, doctors of special education. So for these folks, they assess a particular area where they are really deep experts, whereas psychologists tend to be more generalist. But a speech pathologist, they can assess oral motor functioning and language, OTs, motor integration disorders, sensory processing. PTs are really working on disorders of coordination, movement, motor planning. You have your audiologist, and if you are thinking of getting psych testing and your child hasn't had a vision screen or seen an audiologist, do that first. It's much cheaper. And then you'll know going in whether or not there's any visual or auditory impairments that the psychologist needs to be aware of. And then you have special educators. When I was a special educator, I was trained in how to do educational assessments. Most special educators do educational assessments. That's their role in the special education multidisciplinary team. And then you have special education super specialists who have doctorates in special education, and they're often working in like private practices doing consulting and placement and advising and all sorts of good, useful things like that. So these are other people who do assessment. So different professionals get at information about how to understand a child. Some use formal tests like we do in psychology, whereas others are doing some testing, but other means of assessing. And it's not like one is better than the other. It depends on what you need at a given time. A lot of people start out when their child is first identified as having some kind of difference or somebody's concerned about their development. Often the first stop is a developmental pediatrician. I think you had Dan Shapiro speak for you recently. Dan's a great example of a developmental pediatrician in private practice. A lot of them work in hospitals. So your developmental pediatrician is a pediatrician who has extra training in understanding development and identifying kids who have different differences of some kind. Psychiatrists don't tend to do testing, but what they do is they have very structured protocols for assessment that they do. And so they also will do diagnosis, but they'll do it in sort of their psychiatric methodology as opposed to whipping out a bunch of tests like we do. Physician's assistants, some of them can do testing if they have a specialization in this area. And of course, nurse practitioners. Physician's assistants and practitioners are also prescribers. Unlike psychologists, we're pretty useless when it comes time to figure out if medication would be useful to you. Whereas all the people here on this page not only can diagnose, but they can also help you understand if medication would be a good option for you. Sorry, our practice is still going, and so different people are heading out for the night. The other piece of who is when you get your child tested, you want to know who will be doing your child's testing. Now, if you have a kid who is what has been referred to as a dandelion child, dandelion children tend to grow really fast and they grow without any kind of help, and they do really well in most every sort of situation. Now, a dandelion kid can probably be tested by almost anybody and do just fine because they tolerate everything pretty well. But if you have a kid who's more like an orchid, if you've ever tried to raise an orchid, I've killed many orchids, not on purpose, but orchids are very delicate. They need perfect lighting, they need perfect watering, they need perfect feeding, they need perfect bracing so that they don't fall over. Orchids don't flower beautifully unless they have a lot of support. So think about whether your child or yourself is kind of more like a dandelion person, or are they more like an orchid, or are they somebody who just has a lot of complicated things going on? So if you have a medical condition or a genetic difference, for example, or you have a really complicated set of needs, that may push you more towards, okay, I have an orchid type of kid, or I'm an orchid type of person. So the important thing I cannot stress enough is if you are getting advice from somebody about your child's diagnosis, about what to do about it, please find a licensed or certified clinician. After you talk with that licensed and certified clinician, figure out what the diagnosis means, then you bring in the whole host of wonderful people, attorneys and advocates who can really help you operationalize all of the recommendations and get the plan activated. But for testing, for diagnosis, you really want there to be a professional license. When you go to a hospital, the odds are that they're going to have somebody who's in training doing your child's testing. I trained in a hospital, and the problem with being a trainee is, of course, you are so focused on just learning how to give the tests and how to score them, and what the standardization rules are. You don't really have a lot of bandwidth in the beginning phases of that for making sophisticated observations about the child. The good news about places that use a lot of students or technicians is that they're generally taking insurance, and that's how they can afford to take insurance, because like Children's Hospital, like Kenny Krieger, they're major training institutions, so they're taking your insurance. Maybe the wait times are a bit longer, maybe you're working with a trainee, but it's so much cheaper because they're taking your insurance. And these folks are always under the supervision of a licensed clinician. If you're not sure if that's a good thing for your child, you can always ask exactly how much direct supervision and how much the licensed clinician is actually going to be involved. Sometimes the licensed clinician meets with the family for like a half an hour and then, signs off on the report and never sees the kid again. You can advocate for your child's needs. Sometimes you've got kind of a lower level student. If somebody is an extern, it means that they're really in kind of the beginning to middle of their clinical training. They don't have a lot of experience yet. So if you're having an extern test your child or yourself, you really want to be sure that that person is very closely supervised, because again, these people are pretty green, especially at the beginning of one of their externships. And so some other practices, in order to be able to see more people, will have technicians. Technicians will usually have like a bachelor's or a master's degree, and they administer tests, but they don't interpret tests. That's really a clinical role. So again, if you have an orchid child or a child who really has a very hard time tolerating testing and needs an experienced hand, it might be something to consider who's actually doing the assessment. Here, we're shifting over to when, and I know I'm marching through this very quickly. I'm hoping everybody's keeping up. So when should we seek testing? The real answer to this is that you seek testing whenever you need more information. If a kid is stuck, if a kid is unhappy, if the home life has become really stressful, if you feel like your child's progress isn't where it should be, or maybe there's something happening that is unexpected, like perhaps your child is taking a really, really long time to potty train or learn to speak using verbal language. Whenever there's a need for more information, there's no magic timeline. So you want to seek testing if progress is stalled, when a person's struggling. Let me bring your attention to this one in the lower left-hand corner. Whatever you do, get your kid that last assessment at or after age 14. You don't have to have your kid assessed every 3 years. And what usually happens is by the time a young person is a freshman in high school, the school may say, okay, we really understand your kid. We know what we're doing. Let's not put them through another round of testing. And, from the special educator's point of view, that's a pretty sweet deal, because it means one less person they have to test. And special educators are very tired people. It is a very hard job. School psychologists have caseloads like you wouldn't believe. So if there's a time when somebody doesn't maybe actually need to be tested, they're usually kind of okay with, yep, you're right. I have another kid who's in really serious problems that I need to attend to that child. But here's the thing. Once your child is 14, this is when the transition planning piece of their education kicks in. You really need a last assessment, because that last assessment is your exit ticket. It will inform everything that happens after you leave K through 12 education. And that last assessment is absolutely critical. It sets the stage for what kind of post-secondary education, what kind of vocational training, what kind of living situation. Will your child qualify for SSI, voc rehab, group housing in the area, or supported living, maybe some supported decision-making? All of these things need to happen before that kiddo exits out of K through 12 education so that they can transition into a really high quality life. We are failing kids, particularly kids with autism. We are failing them in terms of providing really good young adult services for them. Most of them are unemployed. Most of them are lonely, and way too many young adults who are autistic are living at home, and that shouldn't be. Again, moving on to identify support needs.
Rebecca?
Yes.
Hi. So there is a question, and I think you almost answered it.
Okay.
And it's about what are the testing requirements to ensure accommodations for college? Are there time limitations? So it sounds like you're saying 14, but is there a time limitation to testing for college accommodation?
Yeah, so for college accommodations, you want to, specifically for college accommodations, you want to have your child assessed as close to age 16 as possible. If that allows them to take adult level tests. With colleges, I did get into colleges because every single college has a different set of requirements. So, you know, if you're going to say Sarah Lawrence College, there's a whole set of documentation requirements that are completely different if you're going to say the SALT program at the University of Arizona. So most colleges, again, I'm putting this very broadly, want the testing to be less than 2 years old, and they want it to be all adult measures. So you might have to either put off testing until then so that it counts. But then again, if you're looking at SAT and ACT accommodations, you want to get your kiddo tested well before they take the SAT and the ACT. This is a good question to ask the guidance counselor or the learning specialist at your kid's school, because they'll really help. They will know your child. They'll know sort of the expected transition plan that's in the works, and they'll be able to advise you very specifically on when, so that you don't get stuck paying for 2 psychological evaluations when you didn't need to. Nobody wants that. I run into a lot of myths about when, and they frustrate me. And Lisa Simpson is my spirit animal, so I put her up there. These are things I see all the time, and I hear them even from well-meaning professionals who ought to know better. So the worst one is just wait and see. Trust us, it's all fine. And just wait and see is kind of the worst possible advice we give to parents, because the earlier you intervene, all the research tells us the earlier that you start helping a child get their support needs met, the better. It will go faster, it will be less disruptive, and it will be cheaper because it takes less time and is less of a big thorny problem if you hit it when it's a small problem. Just wait and see is terrible advice. I've often heard parents who were told that their child was too young to test. When I worked at the hospital, we were testing kids who were preemies from a month after their birth. There is no such thing as too young to test. Now, it doesn't mean that it's the right time to test every child. You want to talk with the psychologist, counselor, therapist, pediatrician about when the right time is, but there is no too young to test. You do not have to wait for a child to be 8 years old. I've heard this one a lot. Can't do any testing until they're 8. Oh, well, by the time a kid is 8, they're often in 2nd or maybe even 3rd grade, and you have missed pretty much the whole first half of elementary school to intervene. That's a terrible idea. The idea that we have to test kids every 3 years. The 3-year piece means it comes from the IDEA law. And you have the right to be assessed every 3 years, but you can waive that right, particularly if your child is really stressed by testing and just finds it a miserable experience, and maybe everything's going fine and you just don't need to put them through that. You don't have to test every 3 years. There's nothing magic about every 3 years. Some kids can get one really good assessment and that will carry them through all they need to get their support needs met. Others need to be tested actually really pretty frequently because their needs are very complex. I hear this last one, or this one in the lower left-hand corner. We can't do any testing because we're doing RTI, and RTI is response to intervention. Maryland is an RTI state. That means that we don't have to wait until a child has an IEP or a 504 plan to start providing some services and interventions. But what a lot of parents are told is that they're not eligible to have their child tested until they hit a certain point in RTI, the most intensive tiers of RTI. This is absolutely not true. Don't let anyone tell you that you cannot get your kid tested because they're doing RTI. And the other one that really, really upsets me is when families are told that their child is not eligible for testing because they are, quote, on grade level academically. It is absolutely incorrect to say that grade level and grades is the only measure of educational impact of a disability or a difference on a child. Please, if you ever hear this, know immediately that you're probably working with somebody at the school who has a shaky at best understanding of special education law, and it might be time to call one of the helper advocates in the community. Okay, I love this cartoon, and I'm guessing people probably feel this way right about now. I'm going to take a deep breath and move into part 2. So what is testing versus what is assessment? Let me just make sure everybody's clear on that. Testing is when we used standardized formal procedures to understand a person. And that can also include an interview. It can be a structured interview, something like the MIGDOS or the ADOS, which are used to understand autism, people on the autism spectrum, or neurodiverse people. Observation can also be a really important part of an evaluation. That may include an FBA, a functional behavioral assessment conducted at the school. Perhaps an advocate, psychologist, special education teacher will observe the child in their natural setting, observe them on the playground, observe them eating lunch, observe them in class to get a sense of what's this child's day-to-day like. And when you combine all three, that's really the sweet spot of really getting a very deep understanding of this person, their strengths, their weaknesses, and their support needs. Now we're into what. So this second half is what and how. So what testing or assessment is actually right for us? Not everybody needs neuropsychological testing. I know in the market space, neuropsychological testing is sort of seen as like the Tesla of testing. It's the most expensive and the most time consuming, and the person doing it has the most training. It must be the best. This isn't necessarily so. You really need a neuropsychologist or neuropsychological testing if your child is particularly complicated, if there's a medical or genetic issue that is impacting your child. Say if your child was a micropreemie, if your child has trisomy 21 or a microdeletion, if your child has a seizure disorder, has had a stroke, multiple concussions, has survived cancer, or maybe is in treatment for cancer. These are all situations where you really do need a neuropsychologist at least once in your child's assessment journey. Psychoeducational testing, this is done by psychologists, neuropsychologists, and school psychologists. It is really understanding the cognitive processes responsible for learning, things like attention, memory, processing speed, all of these things that come together so that we can make progress in reading, writing, and mathematics. This is really attuned to what are the child's educational needs. Neuropsychological testing can be as much attuned to educational needs. It really depends on the experience of the neuropsychologist. There are some neuropsychologists who really focus on like unusual medical conditions and genetic anomalies and such, but don't spend a lot of time really thinking about what should be happening in the classroom. So if your major question is, which reading program does my child need because they're not responding to the whole language program in school, then psychoeducational may be what you're really after. You'll often hear people say, I need, quote, autism testing. And when you go to some of our medical centers, you'll often have a very quick and dirty evaluation. I've seen a lot of parents who have had this, kind of quick and dirty, just a standalone ADOS, the autism. This is a very common interview that's done to identify whether or not someone meets diagnostic criteria for autism. I am personally not a fan of any assessment that includes just one test. I don't think you can understand a human being in all of our complexity and all of our different contexts using just one test, but it's a really good starting point. So oftentimes you go to a hospital, you'll have a standalone, ADOS, maybe a trip to a speech pathologist, and then you get a little brochure that says something like your child has autism or your child doesn't have autism. You can also get testing, of course, if your child is only really having one area where you have concerns. So let's say they have difficulties expressing themselves. Maybe their speech is disfluent. Well, you might not need to go to a psychologist. A good starting point is a speech pathologist. If your child is having motor coordination, body and space types of issues, then OT may be where you go first. If they don't seem to be understanding what people are saying to them, your first stop should be the audiologist, not the neuropsychologist. PT, motor coordination, motor planning, if they, are tripping all the time and having trouble learning to ride a bike, PT is going to be a really great place to get that first assessment. And that may be as far as you need to go. That may very well answer the question, and you can get that done for a lot cheaper and with a lot less time involved than going to either a neuropsychologist or a psychologist. An educational assessment can also be a really good place to start. An educational specialist will be able to take a real deep dive into reading, writing, and/or mathematics and help you understand, are there skill gaps? Are there problems? Does this look like a learning disability? And again, that can be a nice place to start. It doesn't always answer all the questions, but sometimes it's really what you need to go into that IEP meeting and say, hey, my kid really needs some Orton Gillingham here. Orton Gillingham's a reading intervention, by the way. And sometimes you really are asking a question about medication. So sometimes a kiddo is doing fine at school and making friends and happy, but they're so stressed out or they're having so much trouble paying attention that you want to go right to the medical healthcare provider, like a psychiatrist, nurse practitioner, developmental pediatrician, and you might want to go and start out exploring medication and seeing if that's really what it is you need. There is no one gold standard. There's no Tesla of testing. It really comes down to what you actually need to understand your child or yourself. So what gets assessed? All the areas of need. This is enshrined in the special education law. Now, just because it's in the law doesn't mean it actually always happens. And I see this a lot where schools are so overwhelmed that you have the psychologist sometimes maybe even doesn't do any real testing. They just do like an observation and a couple rating scales. Maybe the special educator does some kind of quick and dirty educational screening tools. Under the law, your child has a right to be assessed in all areas of need. You may disagree somewhat about what areas that is, and that's when you bring in one of our wonderful local advocates. You can see they all sponsored this event because or not this event in particular, but they all love xMinds because xMinds helps people understand when it's time to bring in an advocate. These are all the areas that you can have assessed, and we're going to go through those. Now, when you have formal testing done, formal testing in terms of administering a test, something like an IQ test, like the WISC, for example, or the Kaufman test of educational achievement, the Wyatt test of the Wyatt individualized educational test, all of these standardized measures are what we call norm referenced. They produce scores. And testing should not be all about scores, but scores are incredibly useful for quantifying what we're seeing and making it really easy to compare and communicate. So when you get test scores, all test scores are compared to the performance of individuals in your same age and often biological sex. You can also do gender cohort. So if you look at this this, what we call the normal distribution. Right in the middle is 100. So if it says 100 down at the bottom and average up at the top. An average score is 100. The average range for most of your tests, like the WISC, the WIPSI, the WACE, is 100 plus or minus 15. So the average range goes from 85 up to 115. If you're over 100, if you're over 115, that means that unless there's something else going on, the one size fits all of education should be a pretty good fit for you. You shouldn't have too much trouble learning according to, again, the one size fits all instruction. But here's another thing I want to draw your attention to, is that if you look up in the little tails at the end of this, you can see that on the right-hand side, it says extremely high. About 3% of the population score in this extremely high range. These are our gifted kids. You know, the term is usually gifted. We could call these kids, you know, basically they have really good problem solving abilities. They learn very quickly. So if I was to grab 100 kids, about 68% of them would be average, and that's okay. And about 3% of them would be faster and better at learning than the rest of the kids. But then that also means that about 3% of the kids are going to score down in that lower side, that left-hand side of the tail. So out of every 100 kids, we got about 68 who are dead on average. We got about 3% who are in the sort of gifted quick learner section. But then we have about 3% of the people, 3 out of every 100 people, who are likely to struggle and need some kind of support. So this happens more than people think. There's a lot of folks out there who are living perfectly satisfying, high quality, happy lives with spouses, with children, with productive jobs, living on their own, who score down in that area where it means they're going to need some support to get there. We have a big stigma, of course. We all love it when our kids score up in that 3%. It's like, yay, Christmas, you're the best psychologist ever. But it's much harder to imagine when you've been thinking of people who score down in that 3% is like, oh my gosh, my kid's going to turn out like, what, Forrest Gump? No, not at all. We need to get that idea out of our heads. This is just part of the normal variation of human differences. So what are standardized measures? When I say it's standardized, that means that in order to compare how one person does to the whole group of other people that are that person's age. So let's say I want to know how well is this child able to solve problems compared to all the other 8-year-olds ever. I'm going to have to make sure that I follow a lot of very specific rules so that I can compare this one particular child with all the other 8-year-olds. For a test to be reliable and valid, the assessor has to follow these standardized procedures. You can't just make it up as you go along and get valid, reliable scores, because these tests were very systematically designed so that every child will have the same experience so that you can compare apples to apples. Standardized measures, they solicit behavior on demand. Now, this is important to think about. A lot of kids who are autistic or who have differences, quirkiness, anxiety, highly gifted, a lot of these young people are not at their best in on demand. They can talk a blue streak about, all the different presidents or the mechanics of an elevator or the London Underground. But as soon as you sit them down and force them to do tasks that they're not particularly into, well, they may not show you the top of their abilities. That doesn't make a standardized test a bad thing. What it means is that a kid is probably going to have some trouble in the on-demand situation of a classroom. Remember, a classroom, like a standardized test, is one size fits all. A lot of our world, for better and for worse, is kind of one size fits all. And unfortunately, one size fits all means a lot of us don't fit. So for these standardized tests, they are on demand. A kiddo has to be able to get with the program and tolerate that situation of being asked to answer questions, solve problems a certain way, and follow the rules. We know that doesn't always work all that well for a lot of our kids who march to a different drummer. The directions, prompts, and materials, they're the same for every test taker, but we're going to talk about modifications at the very end. For these tests to be valid, it's really, really important that the person you are testing could have been part of the norm group. That's the group of people that this test was designed and created in order to assess. So for example, I can't take a child who has just moved here from China and grew up speaking Mandarin and has only been learning English for 6 months and give them a test designed for American students and pretend that I've come out with a valid score for that child. Here's some myths about psychological tests that I hear a lot. There are no gold standard tests. The ADOS is not a gold standard test. That came out of a bunch of attorneys who would argue that if a person wasn't given an ADOS as part of their evaluation, that wasn't good gold standard testing. The ADOS is a great instrument, but it's not appropriate for every referral question. It's not appropriate for every person. Adults in particular who use spoken language can consider the ADOS really condescending and patronizing. I wouldn't end up using it if, say, I was meeting a college student who was wondering if she's autistic, for example. I often hear people be concerned that test data are not valid for people with disabilities, people of color, people from marginalized groups, trans kids. These tests are really good at helping us understand support needs. They may or may not capture a person's full potential, but what they are really good at is helping us understand, what does this child need to be successful in the one-size-fits-all world of school or higher education or employment? If your child gets low scores, does that mean that they're not making any progress? Absolutely not. Your child may be making fantastic progress and their scores still may look low, perhaps if kids their age are developing faster than they are. Some kids just need more time to benefit from interventions and catch up. Low scores don't mean no progress. They just mean that most of the kids who are the same age are at a different point. A lot of people argue that IQ is meaningless. IQ is really misunderstood, and the fact is that IQ is actually a really good predictor of how well you can achieve in school. They're super predictors of whether or not you're going to be successful at higher education, whether or not you're going to be successful at more complicated types of careers. Are IQ tests flawed? Sure. But overall, they're really good predictors. So if a kiddo is having trouble with an IQ test, this tells us, we've got some support needs we need to meet because something is getting in this young person's way. And of course, test scores are not the objective. A disappointing test score doesn't mean that this child doesn't have a lot of potential and can't have a truly fantastic life and achieve all of their hopes and dreams. You can get a disappointing score or blow a test for a lot of reasons. If you're hungry, angry, lonely, tired, frustrated, overwhelmed, coming down with a fever, there's a ton of reasons why your test scores could not show your full capability. And it's up to the psychologist to be thinking the whole time, is this actually getting valid data? And part of how you check that is you talk to the pediatrician, you talk with the parents, you talk with the teachers, the babysitter, the tutor, the therapist, anyone who can really help you understand the full picture. It's a very famous cartoon. And of course, we have the guy who I guess is the psychologist. For a fair selection, everybody has to take the same exam. Please climb that tree. This is kind of what our standardized tests are like. But again, in school, most of what our kids are expected to do is climb trees, the equivalent of the one-size-fits-all learning program. And if we can use our tests to identify somebody who has different support needs, then our tests have done what they were designed to do. But let's talk about how we can sometimes modify our testing procedures in order to tap into somebody's potential, which is always really fun. So how do we create a useful testing experience for all patients who come to see us? It is an essential piece of the psychologist's ethical code that we do our very best to select an appropriate test battery, modify that battery as needed, and do what we need to do to feel like we're getting valid, trustworthy results. The idea of first do no harm. Another important thing, of course, is that we have to focus on both strengths and areas of need. We're not doing our job if all we do is talk about, all the things that are going great with this child, because the parents need to get the support needs met. They need an IEP, they need insurance to cover services. We can't just focus on the good stuff. That's not our job as healthcare providers. And of course, keep up with the research. Here's sort of a little introduction to how do we actually assess a person's cognitive abilities. I'm just going to give you some examples in case you're curious. We can assess intellectual ability, that basic underlying problem-solving ability, a lot of ways. One of the ways is nonverbal measures, and this is an example of one. The answer is D. So if you look at this matrix pattern, you can see that you have a smaller shape next to a larger shape on the left, and then you have the smaller shape inside the larger shape in the middle, and on the right you have the larger shape, and the smaller shape is pointing in the opposite direction than it was on the left on the right-hand side. So the answer is D. Believe it or not, these type of tests are very predictive of how easy it's going to be for a person to learn in school and how much support needs they're going to need. We also use verbal measures. And for young people who don't use verbal language to communicate, we can still assess their verbal reasoning ability, but we can do it without asking them to speak. So if somebody can signal, if somebody can raise a hand, use eye gaze, blink, tap, I can do a lot of verbal measures, everything except expressive language. So we can assess their vocabulary. Really basic questions like what is a pocket, little more sophisticated, what does hibernate mean? And then more sophisticated as people get older, what is collusion? Analogies and similarities help us understand abstract verbal reasoning. A really simple one for a little child might be, how are Mars and Mercury alike? They're both planets. And then we get more sophisticated, right? Knife is to cut as pencil is to write. And then we can even get more abstract. Poverty is to money as illness is to health. Another really good predictor that is, potentially a minefield, because this is where we can really get into some test bias, is background knowledge. We have to assess this with a lot of care, but it's still a great predictor of how easy or hard a kiddo is going to find school. So background knowledge, what day comes after Monday? Why shouldn't you talk to strangers? And then at the more sophisticated level, we can ask fairly existential questions like, why do societies have laws? Again, we do have tests where people don't have to actually verbally explain. They can point to things and we can get just as valid results. And sometimes it's really exciting when somebody has some kind of reason why they're not able to communicate verbally, when you see that actually their problem-solving ability is better than anybody thought, but they just couldn't share it. We can assess, of course, receptive and expressive language. You want to assess vocabulary, you can do it either by saying like point to excited and show a picture of an excited face, or you can ask, what does excited mean? Morphology, today I eat pancakes, yesterday I ate pancakes. Syntax, make a sentence with these words: cat, mouse, hole, chased. Or you can ask people, do these two sentences mean the same? The dog chased the boy chased the dog. Nope, the syntax is different. They don't mean the same. And then, of course, there's social communication. Idioms like, it was as easy as pie. Questions like, how do you ask a teacher for help? How do you know if someone's a friend? How can you ask your friend to play Foursquare? And I was specifically asked to spend a little bit of time talking about how we assess social skills. Importantly, the real way we assess social skills is we spend a lot of time talking with the parents and the teachers. If we can observe the child in their natural setting, this is really the best way to do it. But we can also assess them through the on-demand environment of testing, and sometimes we'll get a really good understanding of where the weak points are. So we can ask questions like this. Your friend accidentally spilled a drink on you. What would you say and how would you say it? I've had a lot of kids say things like, why'd you spill that drink on me? Or, you ruined my shirt. When of course the socially acceptable response is, oh, it was an accident, it's okay. Another one might be asking them to explain what some idioms or figurative language means. So Roy's teacher said, cat got your tongue? What did she mean? For some kids who are having trouble with understanding idioms and figurative language, they will literally say, well, it means that the cat was biting him on the tongue, or the cat had taken his tongue, so he couldn't answer the question. This tells us a lot about how is this child going to need support as they move into interpreting literature and reading primary source documents and dating and doing all the other things that we do with language in our society. Maybe we have one like this. Kim and Maria had an argument before school. They sat at different lunch tables. Why? This kind of question helps us understand if a young person can take another person's perspective, put themselves in another person's shoes, and empathize with what another person's experience might be. So this type of question is really helpful to us. And then, of course, we can actually do performance-based measures where we show little video clips or pictures, and we can say things like, pretend you are this girl, what are you thinking? Now, if I show a child a picture like this, obviously I can't show you real test materials, but if I show a picture like this to a child and the child says she's happy, she's smiling, that tells me a lot about how hard it's going to be for this child to manage the fast pace of the social milieu and make friends and get jokes and play and work out problems in gym class. If they're getting tripped up by these sort of hard to interpret expressions when they're just still photographs, again, this tells me a lot about what kinds of support this child's going to need so that they can learn all the tools so that they can make friends and get along with people and get married someday and be a great parent to their own kids. I'll go through this part really fast because I know we're running out of time, but you can have the PDF of these slides if you're thinking about having your child's reading, writing, or mathematics assessed. These are the components of an evidence-based reading evaluation. Okay, let me give you a little clue here. A Fontes and Pinnell level assessment, like most of you get if your child is in a public school in Montgomery County, Fairfax County, or DC, when you look at your report card, if you see that your child's reading level is described as a letter, like, oh, you're a second grader and you're on level N, that is a Fontes and Pinnell level assessment. The Fontes and Pinnell system is really problematic because it is not evidence-based, and it has been used to deny countless children access to evidence-based reading interventions because so many parents know their kids can't read, and yet when they look at the report card, the teacher says, yep, everything's fine, he's on grade level, stop being such a helicopter mom. When we assess mathematics, this is what an evidence-based assessment of mathematics includes. It's not just asking a kid to do some problems. For our kids who survived the pandemics, and my kids were right there with you all, it's critical that we discriminate between, okay, where are the gaps? What did our child not get from online instruction and quarantine versus what are underlying cognitive problems that might be causing problems with mathematics. So a real learning disability in mathematics is not just about, oh yeah, I didn't really learn long division. It's going to be a pervasive set of problems that makes mathematics harder and harder to learn as it becomes more complicated. Written expression is our hardest area to assess because it's super complicated. Not only do you have to put your thoughts down on paper, you have to communicate with your audience, organize your thoughts, and then you have to make your hands do a whole bunch of very complicated maneuvers. For little kids, their hands move so much slower than their brain. And then in middle school, it switches over and you get adults and young adults who are writing much more sophisticated things than they are saying. Penmanship, spelling. When I was a special educator, I was told that penmanship and spelling really didn't matter. That was BS. The research is very, very clear that penmanship and spelling are hugely important. So if you're in a parent-teacher conference or in a multidisciplinary team meeting, and you're hearing people say things like, oh, spelling doesn't matter, handwriting doesn't matter, basic math facts really doesn't matter, whoop, that's a red flag for you. You need some better data. Now, just the ending piece here, how do we personalize our testing? Again, how do we understand the full potential of everyone who comes to see us, no matter what? If this person, can not move their hands, if they use technology to communicate with the world, or maybe PECS, like a card system, if they don't see as well as your average person, if they don't hear as well as your average person. When I worked in the hospital, one of the great experiences that I had was getting to work with all kinds of kids. I saw kids, who had no use of their arms whatsoever, and I learned to test them. I saw kids who could only stay awake for like a half an hour at a time, and I learned to test them. I saw kids who had cochlear implants, kids who didn't see, kids with all sorts of, differences in terms of how well they could communicate using oral language. I learned to test them. It can be done. I don't believe that there's an untestable kid out there. There are kids who can't access our standardized measures very well, but a creative, well-trained psychologist is going to know how to personalize testing so that your kid can show what it is they can do. So we have motor-free tests, and we have language-free tests. If you take a look at this picture, this is from the Pearson website. It shows the Wechsler nonverbal. This is a test that requires absolutely no speaking and absolutely no receptive language. You point to the directions and the child somehow either points or confirms their choice, and you can get a perfectly valid IQ out of this. We can also modify standard procedures. Now, ethically, we have to be really careful because when we modify, we're changing standardization procedures. And so our test scores really have to be interpreted with a lot of caution. But for some of our kids with differences in neurodiversity, a couple modifications here and there allow them to really tap into all the stuff they can do. And it's so cool when that happens. So things like shorter assessment periods, movement and sensory breaks, extra explanations and modeling. I call this, this is referred to as testing the limits. A lot of kids with ADHD, because they're very distractible, or kids who are very anxious, they just need a little extra boosting and modeling, and then they get it. And you know what? That's fine. That really doesn't interfere too much with the validity of the testing. I see a lot of kids with ADHD. And so if they want to sit or stand or use fidgets, if they want to lay on the floor, I'm fine with that. I'll note it in my evaluation. But in the hospital, I tested kids who were laying in bed. You figure out how to do it. There's also, of course, use of assistive technology. This has improved greatly since when I first started testing. This should be part of, a psychologist training to do testing when a kid is using some kind of augmentative communication device. And we use support animals sparingly because, of course, a dog is much more fun to pay attention to than my standardized tests, but sometimes it's just what's needed. For some tests like the ADOS, we bring a parent in because the parent's part of the assessment. Typically, we'll bring a parent in as a last resort, in part because you as a parent are very distracting to your child. And having been a parent when my child was getting assessed by a developmental pediatrician, I can tell you it is so hard to keep a poker face and not react at all. And your child, of course, is going to be picking up on signs from you about how they're doing, and that can really compromise the validity of the test data. So we do it, but we do it with a lot of caution and a lot of thoughtfulness. And it's so important to have the testing done in a sensory-friendly environment. When I tested at the hospital, we had fluorescent lights, we had banging doors, we had, sometimes kids were screaming or crying because they were having procedures done, in the next room over. Now that I have the luxury of being in private practice, I have a sensory-friendly environment. Not everyone has this. I get this, I'm checking my privilege here, but if you possibly can, ask ahead of time. If your kid has a lot of sensory issues, Are we going to have to go through a parking garage? Are there elevators? That can be a curse and a blessing. Some kids love elevators. Ask if the bathrooms have auto flush toilets or hand dryers that are really sensory, really triggering for kids with sensory hypersensitivities. Ask about the lighting. If you go to Ivy Mount, for example, the lighting is nice and dim. It's a very sensory friendly, uncluttered environment where kids can be really comfortable. You want to know, is the kid going to be exposed to like those harsh buzzing fluorescent lights or those super bright blasting LED lights? If your kid has a lot of sensory issues, you don't want them tested in a place like that because they're going to get tired and frustrated really fast, understandably so. Is there a waiting room or a quiet place where they can take breaks when they need to recharge? Can you wait nearby? What's the office actually like? If the staff at the front desk, when you call a clinic, isn't happy to describe how the psychologist has thought through making the environment sensory friendly, you probably don't want to work with that psychologist. And of course, how do we accommodate test takers with neurodiversity, special needs, disabilities? This is a set of questions for you. It's kind of taken from my practice webpage FAQs, but when you get the PDF, keep these in mind. Again, if you have an ORCID child or a child who's had some bad testing experiences, or a child or maybe a teenager who really doesn't want to do testing, you need to ask these questions of the office staff or maybe the psychologist or the intake coordinator and really find this out. You don't want to go and spend, $4,000 on an assessment if it's just going to be too stressful and they can't accommodate your child so that the test scores aren't valid. Here are our takeaways. Testing, all about understanding a unique human being. It is not about getting scores. You can get scores for free. You can get scores anywhere. That's not what a real psychological evaluation should be like. It's not a set of scores. And we want to focus in our evaluations. Here's bullet point number 2. We want to document the needs of this child. What are the support needs and why? And we have to have some kind of data to do it, whether it's interview data, standardized test data, or observation data, a portfolio assessment. We've got to have something pulled all together so that the next professional who picks up this report will know, here's what this kid needs to be successful. Here's what this young adult needs to go to college. Here's what this person needs to be okay at this particular employment setting. Testing should be focusing on figuring out how to remove obstacles and discriminations. They can achieve their full potential, follow their path, whatever that is. So again, we're going to focus on both the strengths and the areas of need. Again, we're not doing our job if we don't really hone in on where those areas of needs are and document them very clearly so that you'll be eligible for the IEP or the 504 plan or for insurance to cover your care, list funding, accommodations at college, whatever it is. It's our job as healthcare providers to really understand those weaknesses, those areas of need, those differences. Keep in mind, too, that a disappointing or expected result doesn't mean the assessor didn't do a good job. There's lots of reasons why the testing may just not go particularly well, or why, when you compare your child with sort of the typical kid out there that this test was designed for, why your kid may look different. Again, it doesn't mean the tester wasn't right on with trying to understand your child, trying not to underestimate your child, and trying to make it a good experience. And of course, parents can and should advocate for a good testing experience. You do not want your child traumatized. You don't want them passed around from person to person. You don't want them overstimulated, frustrated, shamed, any of that. It should be a boring day, but not a terrible day, is the way I think about it. And of course, remember, if you have a kid who's 14 or up, don't leave K through 12 education without your last comprehensive assessment so that you have your exit ticket to access the services in the community. Thank you very much. And I'm happy to hang out and answer any questions people have.
Thank you, Dr. Resnick. So right now we're going to turn to the Q&A. We do have a couple questions in the chat. and I will read those out. If
Okay.
you want to ask a question out loud, just raise your hand using the reaction button on your menu. And when I call on you, you can unmute yourself. Then please mute yourself again when you're finished. Okay, so Rebecca, there are a lot of questions about timing, and you addressed some of it already. But basically, you know, the overwhelming question is, how often do you reassess for your child? Are there any circumstances which would merit more testing more often?
Mm-hmm. Sure. So the way I usually recommend to people, get one really good comprehensive evaluation kind of early on if you can. And then you will have a really good framework for understanding your child's support needs. And then you can probably get by fine with, the school doing their periodic upgrades, their screening measures. Again, there's no one magic formula for how often a child should be tested. If everything's going well and you feel good about that your child's happy at school, or that you're happy at school, if they are making good progress without too much stress and you feel like their support needs are met, then you may not need to put them through that again. There are certain points when it's, when you're coming up on a change, things like when you're going from 5th grade to 6th grade and you're going from elementary to middle school to high school. And then of course, when you're planning for transition where it might make sense, but the sort of idea that everybody has to get tested every 3 years. I mean, you certainly can, psychologists will be happy to take your money for you, but your money would probably be better spent focusing on the interventions that are working. But anytime you get stuck, if progress is stalled, if your child is showing you that the situation is not working for them, that they're frustrated, they're unhappy, they don't want to go to school, that's time to get some more information.
And just tagging onto your answer, there was someone who was asking about reassessment, and their school is telling them that if they move ahead with reassessment, the child may no longer qualify for special education.
That is a risk, yes, because the school's hands are tied in some respects. They must follow the IDEA law. So the special education is governed by the Individuals with Disabilities Education Act and the Americans with Disabilities Act. A lot of times interventions really do work. And so a child may make a good rate or level of progress, and the school team may say, okay, our work is done here, well before the parents feel like the work is done, because schools are about satisficing. They don't have to help your child achieve his or their full potential. They have to make sure that you're making some progress towards your IP goals, or that you're on grade level. That's really kind of it. So there's that tension. And so sometimes putting off testing strategically because you want to make sure to get every last drop of interventions out of the school, that's not a bad plan in all cases. And I see Dahlia has her hand up so politely.
Dahlia, you can unmute yourself.
Thank you so much. Thank you. First of all, thank you, Dr. Resnick, for your presentation. It's very insightful. A few of us are Zooming from overseas, from an international school, and I am sure my colleagues have their questions. I have 2 questions that popped into my mind, and one of them concerns multilingual learners, since we work with the population that is predominantly multilingual here, and
Where are you?
we're in Hong Kong.
Oh, I hope you're safe.
Yeah, we're great. And kids do get referred out for psychoeducational assessments quite regularly. As you mentioned, the validity of the tests is questionable because most of those tests, if not all, were normed on the American kids.
Mm-hmm.
So how do we sort of think about than assessing our multilingual learners? So that's my first question. And the second question is, we noticed, well, I particularly noticed that the social functioning component in psychoeducational assessments is very frequently missing. My assumption is that it's not in the psychologist's practice to do that. That was a great sort of takeaway for me, that next time we refer someone with social communication challenges, it's something that we should explicitly ask for. But if there is such a need, what kind of intervention do you usually recommend?
Okay.
Thank you so much.
Thank you. That's so cool that you're in Hong Kong. So the first question about whether or not a test is appropriate for a child, this is such a complicated issue. And usually the idea is, well, verbal tests are more culturally biased. So for example, if I tested a little girl once from Egypt and we were looking at a vocabulary test and there was a loaf of what looked like Wonder Bread, and that didn't look like bread to her. So she looks and she's like, I don't see any bread, even though she'd been in a British school. So there's all kinds of subtle bias. Even nonverbal tests can be biased because a lot of times they'll have pictures. So for example, the C-Tony will have pictures of animals, but it's like a squirrel and an acorn. And if you don't live, on the East Coast of the United States, you would have no idea that a squirrel and an acorn are supposed to go together. So the idea of test bias is really important to consider, because there's been a long and sordid history in the world of psychological assessment of using biased tests to, marginalize people or promote eugenics or racist agenda or anti-Semitic agenda. I mean, you probably are aware of all of that. In terms of assessing these kids, you're absolutely right that an American test would have to be used with a lot of caution. British language tests may actually be better because there may be more similarities. I don't know enough about the educational situation in Hong Kong to know, but I'm guessing that you probably have a countrywide psychological association and probably some province divisions. Like we have Maryland Psychological Association here, you probably have some local ones. And it would be likely that you would have an expert in your community who would be willing to give a talk for the public. I mean, we never shut up, psychologists. So it's not hard to get us talking, and we love talking about testing because nobody else wants to hear about it. So I would contact your local psychology board, the local licensing board, and ask them to help you understand how to read a psychoeval and know whether or not you can have any way of trusting these scores. The other piece about assessing language and social processing, not all psychologists are trained to do that, but we really should, because, for example, if you teach reading, the simple view of reading, right? Language comprehension and decoding skills, that's what we need for reading comprehension. Well, if you haven't established that someone actually really understands language at a deep level, understands figurative language, idioms, character motivations, how do you know whether their reading is actually due to, a reading problem or a language problem, or, that they're having trouble taking perspective, working memory problems? It's just a really important part of a psych eval. If you're not getting it from the psychologist, speech language pathologists have amazing training in this. A lot of times they are so much better trained than psychologists in terms of understanding like phonemic processing and morphology and syntax. So speech pathologists are like such an integral part of the team. And here in America, we like treat them as an afterthought. It's like, oh, does so-and-so have a lisp? No. Oh, well, I guess we don't need speech. But they're hugely important and kind of undervalued here. I don't know whether you have speech language pathologists there to tap into or not, but if you do, they're worth their weight in gold.
Thank you, Rebecca.
Thank you.
So we have a question about asking the pros and cons of the school testing versus getting private testing.
Sure. So I'm definitely not out to bash school psychologists, because school psychologists, I don't know how they're not constantly burnt out, because their caseloads are absolutely staggering and they're in long meetings like over and over and over again. So they don't have that luxury of getting to spend a huge amount of time with a kid. One thing I will say is that a lot of school psychologists have perfectly good training in how to do diagnosis, but they're under a lot of pressure from school administrations and policies not to diagnose. And this is a real problem, because if you think about the people sitting around the table at the multidisciplinary team, the school psychologist is the one who has the training in understanding the test data and the behavioral observations and knowing what the diagnosis should be, but they're often muzzled because it's the idea that, oh, it has to be the team, but that's not really appropriate. So the school psychologist often could diagnose, but often is pressured not to. I'm in favor of school psychologists diagnosing. They're perfectly qualified. There's no reason they shouldn't be able to. The other thing about school testing is that it's a different task. So clinical testing is all about, does this person have a diagnosis? If so, what interventions would help? And the question that a school psychologist is often limited to answering is this person eligible? So does this person qualify for one of the eligibility codes? That's things like OHI, speech language, specific learning disability, autism. Does that person meet the criteria for being eligible under the special education system to be served with supplementary aids and services as a person with that code? So sometimes in the school environment, they're just doing screenings to see whether you're eligible or not. And often those screenings are very quick and dirty and not really the in-depth level that you could get at a hospital or private clinic. But the great thing is they're free. And so it's a good place to start. It's not always a great place to finish, but it will get you, oftentimes IQ, maybe some rating scales, maybe an ADOS, maybe some educational testing. And then you can then take that, go to somebody like me and say, hey, can you do some fill-in testing? And I'll say, absolutely.
Okay, we have Elena M has her hand up.
Hi, Elena M.
Yes, hi, thank you. That's extremely helpful. Thank you so much again. My question is it's kind of two-part. One is, we just did the testing. Our daughter has been diagnosed with ADHD, and we went to the first school meeting, and we heard that really the school in Montgomery, MCPS, really they don't do IEP unless they start with a 504. And I just wanted to kind of validate if that's your experience. And the second is, they really advise us, you say, well, you don't really want to start with an IEP. We really have to do some interventions first before we do an IEP, because it's much more invasive method, an approach, rather than the 504. So I just want to get your thoughts on this too, and kind of pros and cons of IEP versus 504.
Sure.
Anything you can share would be great. Thank you so much again.
So the first caveat is just, since I'm a licensed psychologist, it's unethical for me to give you very specific advice about your child unless your child's a patient of mine. The same way we can't diagnose politicians. People are like, is that guy crazy? And I'm like, I can't say, I'll just think. But I would strongly recommend that you look at the sponsors of xMinds, and those slides were up at the beginning. They're all over the xMinds website. There are a lot of really great advocates who can help you with this situation. What you've been told really doesn't line up with special education law. A 504 is not the starter. It's not like the hors d'oeuvre before the entree. It's a very different way of supporting a student. An IEP provides what are called supplementary aids and services. So this is the special in special education. That may be things like specialized reading instruction, a special classroom, a special school, special pullout services, resource room, all of these extra things that are individualized. And the question of whether or not you get IEP versus 504 is, for the IEP, does this child require specialized instruction that is different from the one size fits all in order to make an appropriate rate and level of progress and fully access the curriculum? A 504 is governed by the ADA, the Americans with Disabilities Act, and a 504 is mostly accommodations. So it's tweaks to the general education setting that are designed to remove the discriminatory impact of one size fits all. And you can also add some interventions onto a 504, but it's not the same in terms of scope. So I would say if you can get an advocate, get one. If you can't, go to websites like the PEATC website or Rights Law and start reading up on this. I can't go too much into your personal circumstance, but what I've heard, I think getting some extra help would be good.
And I will add to that xMinds is going to have an event on January 10th. It's in the chat, the link. The topic will be IEP versus 504.
Nice. Okay. That's a good
perfect.
one.
Thank you so much. Thank you.
So a couple questions in the chat about testing very young children. We're talking pre-K, 4 years old up to grade 2. Are there any, do you have any opinions about how to test very young children? And is it ever advisable not to test them when they're this young?
Well, so the question of whether to test anybody is there something getting in the way for this child? Is there something that is frustrating them, keeping them from playing, keeping them from sleeping, eating, learning, going to school, making friends, going out in the community, all those things that little kids are supposed to be doing. If there's something really getting in the way, then you want to find out what's going on and get rid of that obstacle, or give the kid the skills that they need, or understand their support needs. It's just like if you thought your child was looking a little bit lethargic, you would say, I think I'll take them into the pediatrician. You wouldn't say, oh, well, we better wait until the fever gets to be 105 before we do anything. And I don't mean to be making fun of you. What I'm referring to is there's this sort of weird stigma around coming to see a psychologist, like it's a shameful thing. I mean, we're nerdy, but we're not that bad. We're often really afraid of getting the information. And testing for little kids, it should really be somebody who loves testing little kids, who has the right tools, who has a setting that is appropriate for little kids where they can feel comfortable without being overstimulated. You really don't want the experience like I had when I was working at the hospital. Little kids would come in and, the place smelled like a hospital, and there were, doctors with white coats, and kids were getting shots. And it was not setting the stage for like the restful, calm, supportive environment you want to establish for a little child. But yes, absolutely. Little children can be assessed. We have a lot of tools that we can use that are little kid friendly. And little kids often really like the testing because it sort of feels like games and play for them. It's the parents who are getting all stressed out about it because, of course, we're terrified, like, oh my gosh, is everything okay with my child? Having been through it, I wouldn't say it was a pleasant experience, but I learned a lot and it was important to do it. So don't let that stigma around, oh my gosh, what does it mean to go see a psychologist or a developmental pediatrician or a pediatric psychiatrist? Don't let that get in the way of you helping your child, because you can't advocate for your child if you don't have the information that you need to know what's going on.
All right, it's 8:35 now. Rebecca, we do have one question. I hope you have time to answer. One parent is saying that her daughter is nonverbal and learning to communicate. Are there tests that show best ways to learn new material, best ways to demonstrate understanding?
Absolutely. And this is a situation where I would want to partner up with a speech pathologist and an assistive technology pathologist. Pathologist is the wrong word, specialist. Somebody like Joan Green, for example, who's a speech pathologist and an amazing assistive tech whiz. Because we can, in psychology and neuropsychology, we can do a lot of assessing without the young person having to speak. You know, again, anybody who can signal deliberately in a way that I can reliably pick up on and know whether they're indicating, you know, thumbs up, thumbs down, yes, no, you know, a blink, you know, whatever they can do, if there's a reliable signal, you can test them. So it, you know, just because somebody communicates differently doesn't mean that they're locked out, and you know, we shouldn't underestimate them either, because as we all know, there's plenty of people out there and plenty of autistic people for whom verbal communication is that's not the way they do it. They're not comfortable with it. But the last thing in the world we want to do is underestimate somebody and assume because they don't speak verbally the way that most of the population does, that they're not every bit as able. So yes, definitely can do a full assessment, and it would be a great one to do as like a team effort with a multidisciplinary team.
There is a question about what do you do if your child refuses to be tested?
Mm-hmm. And you know, that's valid. A lot of young people have had bad experiences being tested. It's been medical, it's been embarrassing or shameful. If, you know, young people need to what's called assent. Technically, you can't really consent to anything until you're 18. That's a legal term. I work hard to make sure that I've talked with the parents about how to get, you know, sort of buy-in and explain in really honest terms, here's what we're doing, here's why, and here's what it's going to be like, as well as that young person can understand. You know, obviously, if it's a 3-year-old, I'm going to explain it very differently than if it's, you know, a 20-year-old who's getting, you know, assessed to make sure they qualify for SSI. If people really refuse to participate in standardized testing, then what you can do is you do a really good interview of the parents, you get a lot of work samples and do a portfolio assessment, you consult all the important people in that young person's life, you send out behavior rating scales so you can get some numbers, and, you know, if that's what you can do, that's what you can do. You know, there are certainly people for whom testing is just awful, you know, and from a sensory perspective, very overwhelming. We can still try to figure out how to meet their support needs. We just have to get creative about it.
All right. Thank you for taking a little more time. It's already to answer those questions. Hopefully we were able to cover them. Turn it over to Sue.
Okay, well, thank you so much.
Thank you.
That was a ton of really wonderful information.
Probably too much, but I wanted to make sure to cover everything you said you wanted covered.
Yeah, I appreciate that very much. And we can all be digesting it over time if we look at these slides. So, and we can, since this is all recorded, we can also watch it. So I'd like to invite everyone in our audience to complete our 2-question feedback form from today's workshop. And to get that feedback form, you can either use the link that I think Nora has put in the chat, or the QR code that Annie is going to put on the screen when she shares her screen soon. There we go. Okay, and thank you, Annie. And we have recorded this presentation, and we're going to email everybody who registered for it a link to the recording in the next couple of days. So please join us for the next speaker event in our series. On Tuesday, January 10th, we will have a panel discussion about what accommodations and modifications are available using IEPs versus 504 plans and other kinds of service plans. So I think Nora will put in the link to that event. We put it in the chat earlier as well. So thank you so much for everyone for joining us today. And once again, thank you so much, Rebecca.
Good night, Sue.